So the type of treatment that can be given very much depends on the type of nerve injury. And this can be from as simple as doing an exploration of the nerve and decompressing it, so taking away the mechanical force that is crushing it and stopping the signals running through. If the nerve is cut, for example, then I can do a repair, an end-to-end repair. Or if the nerve was in the first place stretched too much and now there is a gap between the two ends, then I could use a graft or a conduit in order to bridge over that gap. In other circumstances, you may even need to do a nerve transfer. So as part of the transfer, you can take a nerve that is spare and then you can plug that in a nerve that is not working in order to give function to a muscle that was no longer working due to the nerve injury. An example of that would be when, for example, you take one of the branches of the triceps muscle and then you plug that into the axillary nerve that eventually will supply your deltoid muscle. This way you can restore function in the deltoid and therefore the shoulder without losing the overall strength of the shoulder. But the surgery is not the end of the journey. What is more important is the team that is around you. And at the Wellington Hospital, we have a dedicated peripheral nerve injury unit that is comprised by physiotherapists, occupational therapists, clinical specialist nurses, as well as pain team specialists. And in addition, I collaborate very closely with my orthopedic colleagues, as well as neurophysiologists, as well as the musculoskeletal radiologists. So when a patient with a nerve injury comes along, then they can be assessed, they can be examined, they can have their scans, and they can have their nerve conduction studies all in the same journey. Taking this collaborative approach, putting together the surgical expertise, as well as all these multidisciplinary teams, the goal is the same. And this is to give the patient the best chance of recovery, restore function, and improve their quality of life.